For decades, there has been a steady growth towards the need to prepare first responders, municipal leaders, and citizens for mass casualty incidents. MCIs continue to become common events that overwhelm the resources and capacity of first responding agencies around the nation. In addition, these types of incidents can cripple the soul of a community, as witnessed in the months following the Oxford High School shooting. Unfortunately, active assailant events and other mass casualty incidents will happen again, and our first responder community must be prepared for the sake of our citizens and loved ones. Per state and local protocol, a mass casualty incident is defined as any incident due to its physical size, the number and criticality of its victims, or its complexity is likely to overwhelm local resources. Explosions, fires, motor vehicle accidents, active assailants, and hazardous material situations are all examples of incidents that can produce mass numbers of victims that will overwhelm the local first responding agencies. No matter the source of the emergency, an MCI suggests that county, state, or national resources may be mobilized for assistance. In contrast, a multiple casualty incident is an incident that a single agency can manage alone or with the use of its local mutual aid or automatic aid partners. This distinction between a multiple casualty incident and a mass casualty incident, or MCI, does not lie in the number of patients or the extent of the damage, but rather the resources needed to deal with the situation. In preparation for these complex and chaotic events, the Oakland, Macomb, and St. Clair County Medical Control Authorities have collaborated to develop MCI Declaration notifications for each respective county. These notifications allow for fast, clear, and concise informed situational awareness of a mass casualty incident to all hospitals in an entire MCA. Per protocol, all hospitals within an MCA must be notified of a mass casualty incident so that they can be prepared to best serve potential patients. To facilitate and expedite this process, the eBridge MCI Declaration notification allows first responders to immediately put all hospitals on alert and prepare to receive patients. The sooner EMS can notify the hospital of an MCI, the sooner they are ready. The sooner they're ready to receive patients, the better they can sustain a strong continuum of care from the field to the hospital and give the victims the best chance for a good outcome. For example, let's say an active shooter situation creates dozens of gunshot wound victims, as well as various victims that suffer traumatic injuries from the chaos of the scene. Local law enforcement, fire, and EMS respond to the scene and establish unified command. Within minutes, the shooter was subdued by law enforcement as rescue task force teams triage and treat victims. Command assesses the situation and quickly realizes that they are dealing with more patients than their local response can manage, and an MCI declaration must be made. To do this on the eBridge application, first, click on the appropriate MCI declaration icon. Then, fill out the form. You'll notice that the form requires you to input all areas highlighted in red and are self-explanatory. Start by selecting your unit number, which is customized to your agency. Although not mandatory, indicate if you have a mass casualty incident. Then, enter the city or township of the MCI location in this free text area. It is important to at least provide a general idea of the area or location of the incident. Then specify if the incident type is an explosion, fire, hazmat, motor vehicle accident, shooting, or you can select other and enter a brief description if needed. Finally, you can enter additional notes. Whatever you enter, keep it simple. Once you've completed the form, hit Attach in the upper right corner. Prior to sending, review the summary. Remember, the eBridge application allows EMS to send audio, video, or pictures along with the notification to help the hospital prepare. During these chaotic emergencies, consider sending a video, pictures, and/or audio message for fast, clear, and concise, informed situational awareness of a mass casualty incident to all hospitals in an entire MCA. To do this, click on the plus sign on the right side. Then select if you want to take a picture, record a video, or an audio message. You can attach multiple pieces of media if needed, but the process is the same. Going back to our active shooter situation with multiple victims, the incident commander makes the decision to record an audio message that clearly and concisely describes the situation while providing the basic information that will allow hospitals to prepare to receive patients. The IC clicks on Record Audio and waits for the audio recorder to open. Then they press record and simply record an audio message. Once you're done and satisfied with the message, hit attach. Here's an example.
All hospitals be advised that we are declaring a mass casualty incident at 123 Main Street. We are currently triaging and treating at least 12 victims that have suffered gunshot wounds and various traumatic injuries. As EMS units clear the scene, the receiving hospitals will be advised as to the number of patients as well as their triage classification and injury. For now, please monitor EMS traffic and be on standby.
After recording the audio message, you will notice that it is automatically attached to the notification. Remember, you can add additional audio, video, and pictures along with the MCI Declaration by repeating the same process. Once you've reviewed your summary, hit send. From there, each hospital care point station will alert every ER and allow them to access, play, and send the audio message. The sooner EMS can notify the hospital of an MCI, the sooner the hospital is prepared, the better they can sustain a strong continuum of care to definitive treatment and give our patients the best chance for a good outcome.